that, we all please rise. Please rise. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Arnie, will you come up and introduce the guest, please? I'll fight you.
Good morning, everybody. Glad you're all here, healthy. Keep it that way, please. I'm going to introduce all of our guests today, please. So hold any applause until the end. Thank you. Ed Saul from Emily Schlossberg's office. Dana Ackerman-White from Mayor Dave Kerner's office. Linda Cherry, Emily Schlossberg's office. Leslie Schreiber, Sheriff Bradshaw's office. Gabriela Ferreira, Tax Collector's Office, Ann Gannon. Maria Sachs, former Senator. Chris Nordstrom, aide to Kevin Rader. Evelyn Duplessis, Senator Laurie Berman's office. Jenny Caesar, Congresswoman Lois Frankel's office. Howie Zimmerman, Property Appraiser's office, Dorothy Jacks. Harry Rauscher, Lake Worth Drainage District. Let's see, Lisa Cook, Delray Medical Center. We welcome you all. Thank you all for being here. If I missed anybody, I apologize.
Okay. Last month, I announced that it was election time in the Alliance. Anybody who was interested in running for board, contact me. I hadn't heard from nobody, and so the following of people who are elected board members: Rory Villigor, Bob Schobam, Phyllis Levine, Susie Zuckerman, Paul, I forgot you, Paul, and Evelyn Spielhofer, okay. All right, so the election is over. And by the way, it's dues time, so a lot of checks have been coming in. We need your help to run these meetings and everything like that. It's drain on funds. We only raise, we'll have to raise ourselves. So check your community and find out if they have paid the dues. I'd appreciate that, and remind them. And if they didn't get the paperwork, or they want to, they need more paperwork, if they contact me or Laurie or by mail, by email, anything of that sort, we'll take care of that. And with that, we're going to start the meeting this morning. We have a full schedule and a lot of important work to do. So I'm going to call on Captain Kent. Come on, Captain. And give him a big hand. You're doing great work.
Thank you, Bob.
Welcome.
Good morning. Good morning. Glad to see everybody here. Hope everybody's doing well. You too. I got my eyes on you. All right, overall we're doing pretty good in the district. We really are. I'm pleased to announce to everybody we're at a nice place with crime. There are a couple of things that I want to go over with you this morning that I'm starting to see kind of creep up on us a little bit. I'd like to stay ahead of it if we possibly could. If you haven't noticed the traffic out there besides me?
Oh my God.
Oh, yeah. Please leave yourself some extra time in the morning or in the afternoon or at night to get where you're going, all right, because we're starting to see a little spike in traffic crash as well. Pleased to announce really nothing of serious nature, but it's going to slow you down a lot more if you're going to want to get into even a small fender bender, okay? I'm going to touch on the thefts of the tires and rims. You guys have heard me say this before. Several months back, we're starting to see the spike in it again. They're targeting predominantly Toyotas and Hondas early morning hours. And folks, they're taking everything. The tires, the rims, everything. So what I need you to do is be very vigilant. See if you can park. I know there's limited spaces with lighting, but make sure he's working closely with your homeowner association to make sure that there's ample lighting in the parking lot. Make sure you're communicating with each other and the other residents for awareness. but we're starting to see that spike. And let me give you a location where we're starting to see clusters. We're looking between Lake Ida Road in West Atlantic. That'll be the north and south boundaries. The eastern boundary is going to be Jog Road out to Hagen Ranch. We're seeing a cluster of at least 7 of the 13 that have occurred in the last couple of weeks right in that area. Now, that's not to say that it's not going to move, but right now that's where we're concentrating a lot of our efforts because the pattern is starting to appear there. Give you some more data. We're looking Tuesdays. I'm reading off my analyst report. We're looking at Tuesdays as predominantly the highest amount of these crimes occurring. And they're occurring between, in early morning hours between 2 o'clock in the morning and 5 o'clock in the morning. 13 in total so far. We had 1 in December of 2019. We had 3 in January, and we're up to 7 in February. So you see which way the graph is moving, all right? So there's not much, I understand there's not much you can do except just be aware of it and communicate this to your neighbors and your friends and families. I'm going to give you all a hypothetical. It's really not, but just play along. If you got a phone call from somebody posing as a DEA agent, identifying themselves as a DEA agent, and for those that don't know what DEA means, it's a Drug Enforcement Administration. And that DEA agent says to you, ma'am, sir, your identity has been compromised, and it's going to cost you $15,000. $15,000 for us to restore that. But wait, there's more. There's always more. That $15,000 we don't need in cash. What we need you to do is go and get us gift cards. Wait for the punchline here, folks. We need $15,000 in gift cards, and we need you to call us back at this number for security purposes. Really make it sound really legit. And we need you to give us the identifying numbers on those gift cards, and then we will work towards being able to release your identity to make you whole again. Now listen, by a show of hands in the room, and I know my audience, I got some real smart people here. By a show of hands, who, and don't be ashamed, who would comply with that request? Me too, no, I'm just kidding. All right, so I put that out there for a reason because my assumptions come true. I believe what you say, that you wouldn't. So I need something from you. I can sit here and tell you about it month after month, right? You guys can be enlightened and educated, but where are we going to go from here? So I need a pledge from you to continue your support like you always do with us, is I need you to reach out for at least 10, 15, 20. Reach deep into your contacts. And please give them what I just told you, the story I just told you, because folks, it's true. I didn't make it up. It's right here. And I sit there at my desk, and I'm reviewing these cases, and I want you to put yourself in my position. I think you guys understand my pledge to you is to protect you and to serve you, and I will do that all the time. But do you know how frustrating it is for a guy like me, or us, the sheriff's office, to be able to see this and feel so helpless for this person? And it's not an extremely elderly person that's maybe not as lucid as she was or he was. This is an average person. I won't give you the name or the age, but it doesn't fit the profile you guys all may be thinking like I was. All right, so I need your help. You guys in it with me?
Yep.
All right. All right, thank you very much. Anything else? My door's always open. I'm only a phone call away. I'll see you next month.
Thank you, Captain. Okay, here we go. Chief told me. Come on, Chief. Give us the count.
Thank you, Bob. Good morning, everybody. Good morning. Yeah, I'm getting up there. I used to make fun of my peers that when they got promoted to chief officer and they were behind a computer screen, I'd go in to visit them, and this is what I would see the first thing. Like, hey, when did you get glasses? We'd laugh. We'd get a good laugh out of it. Well, I think I lasted maybe 2 or 3 years, and here we are. All right. So for starters, we had a busy month of February. Station 46 ran a total of 275 calls. Station 47, 394. Station 48 ran 240. Station 52, 172. Station 41, 567 calls for the month. Station 42, down the road here, 466. Station 44, 350. Station 45, Kings Point, 607 calls for the month. So it's been busy. Our friends from the north are down. We welcome them. We're glad everybody's here. We just want to, again, ask everybody to be safe. Pay attention when you're on the roads. Like Captain mentioned, no texting. None of the superfluous things that are going to get us in trouble while we're driving. We got the good doctor here from Delray that's going to be going over, or the healthcare that's going to be going over the coronavirus. And so I'm not going to steal any of his thunder, not that I could anyway, but I do want to just reassure you that fire rescue is prepared. We have a full comprehensive emergency plan in place for our guys and gals that are out in the field, as well as a plan in place for our dispatchers that they're currently using. That's a screening tool to help prepare our guys and gals before they get out to the homes. So we're doing everything we can do. I'm going to keep it short today so we can give adequate time to the doctor to go over this very important subject. But it's great, wonderful seeing everybody, and please have a safe month.
With that, I'm going to call on the doctor to give his report. You have to send him back here. He left in the middle of operation or something. Come on, doctor.
This is Dr. Octavio Diaz from Delray Medical Center.
Thanks, Lori. So thank you very much. So I've been given 5 minutes to talk about the hottest topic on the planet, so I'm going to go real fast. So I hope you guys can listen pretty fast. So before I get started, I want to make sure we level set and understand the coronavirus or the COVID-19 virus. It's in the press. Everybody's very well aware of it. You cannot escape the information that's coming to us, and we're being bombarded from every angle. But let's just set the record straight. So COVID-19, which is this new coronavirus, is a virus that originated in actually bats and was transmitted to humans somewhere in Wuhan, China, as we all are very well aware by now. But here's the numbers. As of this morning in the United States, there's been 9 deaths. There has been 130 infected people in 16 states. Throughout the world, there's been 3,200 deaths, 93,000 infected in 70+ countries. But let's compare that to the seasonal flu, or the flu that is plaguing us every single winter. So for the 2019-2020 flu in comparison, so far, year to date, in the United States, there's been 23 million cases. There's been 310 million hospitalizations, and 310,000 hospitalizations and 18,000 deaths from the seasonal flu. So in comparison to the 9 deaths that we've had. But here's the problem. The coronavirus has a mortality rate of approximately 2%, or just under that. So if you get infected, there's a mortality rate somewhere between 1.5% to 2%. Comparing that to the seasonal flu, which has a mortality rate of 0.1%. So what are we doing at Delray Medical Center, and for that matter, at the other hospitals in Palm Beach County? All of the hospitals are really committed to 3 key things. Number 1, protecting our patients. Number 2, protecting our healthcare workers. And number 3, protecting our community. And the best way for us to do that is to decrease the spread of this virus. And all of us in this room can take part in that as well, and I'll go over some tips at the end. So at Delray Medical Center, and we also have a partnership, as you know, intended with Good Sam, St. Mary's, West Boca, and Palm Beach Gardens. We have ample supplies on hand, and we have ample supplies at our home office in Dallas to provide all of our healthcare workers with protective equipment that's necessary. That's the first step. The second step, though, is education. We all need to be on top of this virus, and we all need to understand what it means, how it's transmitted. And we at the hospital need to make sure that 100% of our healthcare workers, and I'm talking about everybody, the nursing staff, the physicians, the workers that are cleaning the rooms, etc. They all need to understand how they put on and take off protective equipment. So we do continual education, including just-in-time education. So if we do have a patient under investigation, we're re-educating our staff at that point. And we plan. We planned for previous infectious diseases, and we plan this time over and over and over again, including drills on how we're going to deal with either a very small influx of patients, which we hope is all we see, or a very large influx of patients, which we're also prepared to deal with. And communications is key, not only from us to our own leadership staff in the hospital, but also for the Department of Health and for the CDC. We're in constant communication and receiving constant updates from those entities. And finally, a very strong partnership with our EMS. I can't overemphasize that enough. We have their back, they have our back. So when we know that there's a community patient that is a potential patient under investigation, they're aware, they alert us, we're aware, we prepare our emergency department to receive that patient, and equally we assist them in making sure that they're safe in the transfer of that patient as well. So partnership is key, and I'm very happy to have heard the chief prior to that. So how can we protect ourselves, each and every one of us? And there's really just a handful of very simple steps. Number one, don't panic. Think of this no different than the flu. It's transmitted the same way. Keep in mind that roughly 80% of the patients that get the COVID-19 virus, this coronavirus, roughly 80, maybe a little bit more percent of those patients get mild symptoms. In other words, they get a cold or they get flu-like symptoms and it passes. If you're ill, the advice is to stay at home. If you're caring for someone who's ill, make sure that you are diligently doing hand washing techniques. If you are in a room with someone who's sick, stand 6 feet away from that person, because that's where the air droplet range is, roughly 6 feet. Masks actually make things worse. So wearing a mask in public may actually be detrimental because you're constantly touching your face. And that's one thing that we try to avoid. And by the way, if you think about how many times a person touches their face in 1 hour, it's roughly 40 times. So you go at your face, regardless of how much you try to prevent it, that nose is going to itch, and you're going to go at your face about 40 times. And just think about that while you're sitting in this audience, how many times you've reached and touched your face. So hand washing is really the only way that we're going to prevent this from really spreading. So copious hand washing for 20 seconds or longer, using a decent soap, and also the alcohol hand cleansing is also very appropriate. Last thing I want to mention is stay healthy. This is the time to eat right, to get your exercise, and to get your sleep so that your immune system can stay up to speed and fight off anything that you might be encountering. I think my 5 minutes are up, so I'm going to stop here. I really appreciate your attention. Thank you so much for having me.
If you need it, I'll get another one. All right, I'm going to call on Commissioner Mary Lou Berglund. Commissioner, how are you? Good to see you, as always. You're always here supporting us.
Good morning, everybody. Good morning. It's so good to see all of you. My first question is, how many of you have fallen down the stairs because you weren't paying attention? I just did that last week. Not fun. Please pay attention when you're anywhere near the stairs, because I fell and I ended up at St. Mary's. I was not close to Del Rey, but if I had been close to Del Rey, since I sit on the board, I would have gone there. But I was taken to St. Mary's. I'm fine. My pride is hurt. That's about it. And a huge, huge bruise. So please, please be careful when you're doing that. The other thing I wanted to touch on, see, I'm getting old, so you forget those things. I also want to, the doctor that spoke from Del Rey Medical Center, do heed all of his advice. It's a good idea to follow it, and we don't need people to get sick, because I don't want to come to a meeting and the place is empty because y'all got sick. So don't do that. And I can't remember what the other thing was, so it must not have been very important. So I will turn the mic back over to Bob and just tell you that, please, again, be careful and watch where you're going, especially when you go down the steps, which I will do very carefully.
Be careful. I'm going to call on Karen Bell. She represents us, the county to the school board. Karen? Sure.
Good morning, everybody. Good morning. So I don't know how many of you know this, but the school board is the largest employer in the county. And on top of that, we serve nearly 200,000 students. So that's a lot of students. I know those of us from the north, we're used to the small school districts. So of course, without panic, we had to take action on the coronavirus because we have so many employees and so many students. And so I just wanted to let you know what we are doing right now. First off, we are now well into the first week of a deep disinfecting of our cafeterias because we want to make sure that they're always clean, but we wanted to take it to another level. Now, the superintendent told me there's a lot we're not being told at the school district. He's going to inform us tonight. But when I met with him yesterday, he was going on to a conference call with the Surgeon General to find out more information. So what we are doing right now also is using this as a teachable moment. Because for all of you educators out there, you know, when things happen, that's what we have to do. So we're teaching everybody better hygiene. Some of you may have seen on the news and on the TV that they're saying when you wash your hands, use warm water and do it for 20 seconds. They said that 20 seconds is singing happy birthday twice. So we're teaching the children to do that. We're encouraging our parents, if your child is ill, keep them at home. There's a lot of ways that they can learn at home, on the computer, doing their activities at home, and also to our employees. So we have to take this very seriously because all the children and all our employees are in close proximity. But again, we don't want anyone to panic. And let's use this as a teachable moment so that those extra hygienic steps will carry on. Thank you.
Thank you, Karen. And I'm going to call on sponsor our breakfast this morning. That's Stanley Steamer of South Florida and Mike Scalera. Come on, Mike. Yay, Mike.
Thank you very much. Good morning, everybody. Believe it or not, I am not here to talk to you about carpet cleaning today. And actually, I was planning on speaking to you about air duct cleaning and indoor air quality. And I'm going to shift that a little bit more towards the indoor air quality portion of things, considering the climate. So we actually have a process, and in the air duct cleaning process, we spray a solution, which is antiviral, it's antimicrobial, antibacterial, kills 99.9% of allergens and viruses and whatnot. I'm a little nervous, so excuse me. But we use it on every single job, and we use it in mold remediation jobs. We use it all the time. We spray people's homes, disinfect homes, stuff like that. And we checked with the people who created the product, and they told us that not only did it kill the 2 previous strains of coronavirus, but they said that we can state that it is effective on the current one. Whether that means that it 100% does kill it, I don't know. I have to double check on that. But what we're doing right now to try to stay proactive is we are spraying all of our vans every single night. We're spraying our entire office. We have limousine companies that they're spraying their vans every night. And so what we have done in the past as well is we have sprayed South Florida Science Museum with the product. Let me see. Schools, daycares, hospitals. I mean, we're everywhere we can be spraying this product. We can also provide the product to the facilities themselves to spray themselves as a cost-saving measure. And how it's applied is through electrostatic application. And what this means is that if you were to take a fogger and point it at an apple, for example, and just spray the front of the apple, the solution would only get the front. With the electrostatic sprayer, what it actually does, it charges the solution and sprays it out of the applicator, and it actually goes around the entire apple, right, and it gets full coverage of the entire object, which means you can literally walk into a room with this device and the solution and spray said room in 30 seconds. A 12 by 14 room is completely covered, completely disinfected. Okay, so if you have someone wiping down counters, wiping down classrooms, imagine the man hours, how much product they're using, and how much they're not getting. So we have a really great opportunity with the application and the solution that we have to be spraying just about anywhere that would like it and needs it. So if anybody wants some more information on that, I'm going to be hanging out over there for a while. Again, my name is Mike, I'm in Stanford, South Florida, and yeah, you can get a shout. Appreciate it. Thank you.
Okay, now we have our Executive Vice President, Dr. Lori Vinegar, who's going to run the regular program.
Okay, thank you, President Bob. This Avoid, Deny, Defend. Remember, we are sending out this flyer and we're sending it out by email. The link wasn't working, so now you'll be able to write to Lieutenant Morales by email. That'll be sent out to our distribution list, that flyer. But today you can actually sign up right over there. And Karen's got a sign-up sheet, and we'll get that information to the sheriff's office, and you'll be signed up for that April 14th event, which will take place right here, about citizens' response to active shooters. You have this at your table there, and some updates on the coronavirus, the little points on what to do, and the doctor went over that. And I was also asked, someone requested by email to talk about the rental bills, and the most up-to-date, as of yesterday, information on those vacation rental bills is written right here. And the Senate version just got temporarily postponed in the last committee stop, so it seems that it is unlikely to make progress this year. But that's just the update yesterday. It could change, so watch those emails that come out. This came from, thank you to Representative Tina Polsky for this information. And then there's, of course, the Terra Nova development update, and we did the best we could with that, and we'll be hearing more about the expansion of Atlantic Avenue from our first speaker today. We've seen him here before. He comes every year, even though we have slings and arrows, but he still comes, and he still gives us the update. And Bob and I have been up to the TPA testifying, trying to get things moved up, and it was moved up, not fast enough for us though. We'll hear all about it from Nick Uren, and then following that will be Steve Abrams, our former commissioner, former mayor of Palm Beach County, excellent speaker, and he's going to give us information on the South Florida Regional Transportation Authority, and that's getting around, with mass transit, Tri-Rail and all. We're going to have these two speakers, and then after that, we'll bring the microphone out, and you can come and ask either one of them. They'll still both be here after both presentations. So the first speaker today, Nick Uren, Palm Beach, the Executive Director of the Palm Beach Transportation Planning Agency. You can give him a round of applause.
Well, thank you, Lori, and good morning, everyone. It's a pleasure to be with you, I think. Intimidating introduction. I'm glad to be here with you this morning. Again, I'm the director for the Palm Beach TPA, and Lori asked me to come and give you a brief update, and actually gave me a title for the presentation, Getting Around Safely and Quickly. And I wanted to talk about both of those two adverbs, safely and quickly, today. As a reminder, I was here last in November of 2018, gave you an update on the Atlantic Avenue widening and the investment timing of those projects. I'm going to give you that additional information. I understand that the DOT had representatives here I am touching my face, I'm thinking very self-consciously about that now. The DOT had representatives here talking to you in April of last year. And so I'm here now in March of 2020 to tell you where we stand today. As a reminder, the Transportation Planning Agency is a board of 21 locally elected officials. Mary Lou Berger from the County Commission is one of those 21 elected officials. 5 of our 7 county commissioners sit on the TPA governing board, along with 15 of our municipal elected officials from our 13 largest cities, and we also have one port commissioner from the Port of Palm Beach. Our mission is very simple: to collaboratively plan, prioritize, and fund transportation. We do that by allocating federal and state gas taxes to the projects and the services that have the most beneficial impact on our local communities. And our vision is to accomplish or implement together a safe, efficient, connected, and multimodal transportation system. And I think you'll hear some parallels in the title that Lori asked me to use in our vision statement. Safety is number one for us, and it's the first thing I'm going to talk about this morning. And efficiency speaks to the ability to move around quickly, to move around with relatively low impedance or congestion, and we're going to talk a little bit about both of those. So, why do we care about safety? Well, first, because nationwide, between 2008 and 2017, 50,000 people were killed on our nation's transportation system just because they were walking near a car that crashed into them. 50,000 people. We talk about the coronavirus as an epidemic. These numbers blow any of that away. It is a radically important conversation topic that we have got to address as a country, as a community. And unfortunately, as we evaluate the level of danger, the level of crash incident rate that occurs in different urbanized areas in our country, 8 of the 10 most dangerous metropolitan areas are here in Florida. There are a couple of primary reasons for that, one of which is the air conditioner, and one of which is the post-World War II baby boom. South Florida was developed primarily in a suburban land use pattern after World War II, in 1950s and forward, and we are spread out. We like the experience that we get from our suburban land use pattern, but unfortunately it results in large, wide roads where cars tend to drive fast, and when pedestrians walk along them or bicyclists travel along them or across them, if they happen to be involved in a crash with a car, that car tends to be moving quickly, and it tends to result in a fatality or a serious injury. We in South Florida, Miami, Fort Lauderdale, and Palm Beach counties are number 14 on that national list. We tend to average here in Palm Beach County around 150 to 180 traffic-related fatalities every year. The trend tends to track with the level of traffic congestion and with the level of vehicle miles traveled. How much are we driving tends to influence how many traffic fatalities we have in a particular year. But we are committed to reducing this number. We are paying attention to it at the TPA, and we are working actively to reverse the trend of upward growth in this particular number and try to turn the curve downward, even to the point of eliminating traffic-related fatalities and serious injuries. On the serious injury side, the numbers are similar, but higher. So we have about 150 to 180 fatalities in a given year. We have about 1,100 serious injuries as a result of traffic crashes every year. What are we doing specifically to address that? 4 years ago, the TPA adopted what we call a complete streets policy, where we said not only are we going to provide roadways that accommodate cars, we want to mitigate congestion, we want to provide a transportation system that works for cars, but we are committed to also protecting our most vulnerable users, providing roadways that have clear space for pedestrians, clear space for bicyclists, and clear space for transit riders. Where are they dropped off? Where are they picked up at their service points, the bus stops and whatnot? How are we accommodating the rest of their trip when they're dropped off from a transit vehicle to get to the front door? Have we provided a safe place for them to walk along the roadway? Have we provided a highly visible place, a protected place where they are permitted to cross the roadways to manage those conflicts between pedestrians, bicycles, and auto vehicles? We have also established complete streets design guidelines and said not only are we committed to that in concept, but we have developed a sense of how to build roads that actually implement those policies and priorities. In 2018, our TPA Governing Board adopted what we call Target Zero, or a commitment to eliminate traffic-related fatalities and serious injuries. In 2019, just this last year, we adopted what we call a Vision Zero Action Plan. Again, identifying specific things that we can do to make progress toward that ambitious commitment to eliminate traffic-related fatalities and serious injuries. And I'm going to give you a couple of highlights from our Vision Zero Action Plan, things that we've been working on just this past year. First, we've been focusing on policy-related actions, advocating for changes to state law, changes to the way that we build roads on a state level and on a county and city level. The Florida Design Manual regulates how state roads are built. The Florida Green Book is another document that the DOT produces that regulates how the county and the municipalities in Palm Beach County and all throughout Florida have to build county and city roads. On the changes to state law, I wanted to make sure that you are aware not only is it a bad idea to text while driving, it is also a primary offense now. As of July 1st, it became a primary offense. There was a 90-day warning period where if you were stopped because you were texting while driving, you were issued a warning. As of October 1st, you will now be issued a citation. So please don't text while driving. Please devote the time and attention necessary to operating that motor vehicle in a safe manner when you're behind the wheel. And we're also developing a predictive crash analysis for our roadway projects. Not only are we identifying projects that we need to build to address growth and transportation demands, but we're also trying to evaluate what beneficial or, in some cases, adverse impacts the construction of our transportation projects may have on overall safety. On the funding-related actions, we conducted the TPA an annual call for projects on state roads, on county and city roads, and even on local roads, smaller roads that we can invest in non-motorized infrastructure. And one of the things that we've identified is that people are more vulnerable at night. And so we have allocated more points to projects that submit to us that say we want to include street lighting in our project so that we can promote higher visibility for those vulnerable users, especially as they travel at night. So we're currently doing that. We are also developing performance measures for the projects that we are funding throughout Palm Beach County to identify how much of a beneficial impact did they have. We're predicting the impact and then we're going backwards and looking at how much of a beneficial impact did those projects have. We are actively monitoring pedestrian and bicycle activities. We're counting pedestrian and bicycles as they travel on our roadways so that we understand where the current activity levels are and how to protect the users that are there already, while we're also actively investing in better facilities to grow the sense of comfort and a willingness to travel on our roadways by walking or biking. And then every time there's a resurfacing project or there's a maintenance project that's going on, we are advocating for and including, with additional funding, additional infrastructure so that instead of just resurfacing a road, you also install a high visibility crosswalk. You add the streetlights, you add the bike lanes, you add those sidewalks that are necessary to promote a safer environment for everyone using those roads. On the cultural related actions, and this is where the strong appeal is to this group, we are committed again to Vision Zero, and we're helping to educate our communities, to educate our elected officials, and to build a supportive, collaborative relationship, a commitment together to take transportation seriously, to travel safely, to care about one another as we're driving, as we're walking, as we're biking. We're participating in safety events, and we are asking for members of our community to execute a pledge to slow down. You heard it earlier from both police and fire rescue, but the request is when you're driving a vehicle, travel at a safe speed. Take that responsibility seriously, slow down, and pay attention to the cars, the people walking, the people biking around you so that we can all arrive at our destination safely. And we're also developing right now an online comment map so that when you see things in your local communities that you identify as problems, you can send those to us and we'll route them to the right agencies and try to address them in an expedient manner. So, then we get to this, what about moving quickly? That's our safety initiatives, but what about moving quickly? Well, here's a photograph of State Road 7 and Atlantic Avenue. This is the southeast quadrant. The left side of the screen is 2017. The right side of the screen is 2019. As you can see, there are a lot more people here now than there were just 3 years ago. A lot of those row crops have been converted into row housing. There are houses in that area, that are occupied by people who are now driving on State Road 7, on Atlantic Avenue, and on the surrounding roadway networks. They're creating additional travel demand. So what are we doing about that? We're monitoring, continuing, and I mentioned this last time I was here, we're continuing to monitor the traffic levels. And what you see here, the red bars are the amount of cars on a typical day driving on Atlantic Avenue from State Road 7 to Lyons Road. And that horizontal line in the middle of the slide is the point at which that 2-lane road starts to feel really busy. And we're getting closer and closer to that point where it starts to feel really busy. Now you might say, well, it feels really busy already during rush hour, and that's true. But we're monitoring it on the course of a 24-hour period, and we're saying it's going to continue to feel busier as we continue to add houses, as we continue to add shops and offices and retail sites. You're going to feel that. The blue lines are the traffic counts on Atlantic Avenue from the Turnpike to Hagen Ranch Road. And I just want to mention, so that they're about almost double, or a little more than double. And we're seeing that area also reaching a point where it's really busy. To use a very technical term, it's a very busy section of a state highway, and Atlantic Avenue is a state highway. I just want to mention and say I'm so encouraged by the level of attention to detail that this community pays on transportation impacts. I don't know of any, well, I shouldn't say any, there are only few entities like the Delray Alliance who would actually distribute a newsletter with turning movement diagrams on it. That's a rare level of attention to detail, and I just appreciate how much you care about providing a great transportation system. This is the part where I get to turn my back and take all the arrows that are coming and hopefully survive to continue to work for you to accelerate it and construct some projects. Things that are happening in the Western Atlantic Avenue corridor in particular, I'm just giving you a timeline. First, you noticed that the State Road 7 corridor south of Atlantic was recently resurfaced. That resurfacing project did do exactly what I suggested it would. It added the bike lanes, it added the wider pathways and the sidewalks, and improved the street lighting along that corridor. That same concept is being constructed right now north of Atlantic Avenue up to Boynton Beach Boulevard. You see the barrels that are running along the outside of the road as you drive that? That's what DOT is going to be doing. They're not widening that road, they're resurfacing it, and they're improving the pedestrian and bicycle facilities and the safety for all of the users on that corridor. Second project that's coming up is in 2 years, in summer of 2022, we're going to go under construction to widen the west portion of Atlantic Avenue from State Road 7 to Lyons Road. That project will widen from 2 lanes to 4 lanes, and it will also add bike lanes and sidewalks, improved wider sidewalks to the corridor, and that's going to be at a cost of about $27 million. And what I wanted to point out to you, and the reason some of these projects take time, is that of the $27 million, $12 million is being expended in right-of-way acquisition. So part of our challenge is to come up with a design that minimizes the impact on the adjacent property owners and still provides the transportation benefits that these communities need. And the portion east on Atlantic Avenue from Lyons to Jog, widening that section from 4 lanes to 6 lanes and adding those same bike lanes and sidewalks. The design, the preliminary design, project development, and environmental assessment is underway. That's happening right now. Full detailed design is going to happen in 2 years, and unfortunately construction is not scheduled to commence until the summer of 2026. That's because it is an incredibly complicated corridor to build between the homeowners and the communities and the commercial uses on the north side and the Lake Worth Drainage District right-of-way on the south side. We are looking carefully at all the details of how to build that project in a way that minimizes impacts to those important other services, facilities, residents, and businesses, and still, again, provide the mobility needs that this community is calling for and saying, let's make that happen faster. I do want to mention that, and I think the DOT talked about this back in April of last year, there are 2 planned major construction projects for the Turnpike as well. The section of the Turnpike from Atlantic north to Boynton Beach Boulevard is scheduled to be widened from an existing 6-lane facility to a full 10-lane facility. So they're adding 2 lanes in each direction. Right now there are 3 northbound, 3 southbound, added up to 6. there will be 5 northbound, 5 southbound, adding up to 10. That's a $260 million project. It's a major construction project that's scheduled to go underway in about 4 years. 3.5, 4 years construction time frame for start. And then south of Atlantic Avenue down to Glades Road, again widening the existing turnpike section from 6 lanes to 10 lanes. And that's a $310 million project that's farther out. That's actually in 2028 or 2029. Now those dates may flex a little bit as turnpike toll revenues are variable and as turnpike project prices are refined. But I wanted to give you a heads up that those are also contemplated for this western Delray area as major investments in the regional transportation system to allow people to move through the area. Last, just want to close with this. We are striving as an agency to work with you and for you. Again, Mary Lou Berger is your representative on the TPA governing board. We are seeking, consistent with the Delray Alliance's mission and vision statements, to build a community that serves the best interests of all of the residents and to understand and address your concerns. And particularly, we are working in partnership with the DOT, who is the entity designing and constructing the Atlantic Avenue widening projects. We are pushing on them at every opportunity to consolidate the phasing, meaning let's do some things at the same time instead of doing them in series, one right after another. Let's do them in parallel, and let's get the projects under construction as quickly as possible. So we are working on your behalf to accelerate the delivery of those needed infrastructure projects. And Lori, with that, I'm going to close.
Thank you. Thank you. And we are going to have a question and answer session right after our next speaker. Steve Abrams, everybody knows him, they remember him. He was term limited, unfortunately, as county commissioner. But we got a good county commissioner to follow him, Bob Weinroth, he's great. But Mayor Abrams, he was mayor of Boca Raton for three terms, correct? Wow. And also mayor of Palm Beach County. And now he heads, and when I used to drive up, I still do, as you know, last week I drove up to West Palm Beach, and I drove down a certain street to get to North Olive Avenue. There he was, walking from the transit. He takes mass transit, so he'll be speaking about that today, about the future of Tri-Rail and Brightline's future, and about what he leads. He's the executive director of the South Florida Regional Transportation Authority. Steve Abrams.
Thank you, Lori. And to my friend President Bob, great to see all of you. I represented Delray Beach on the county commission. I had a good portion of it east of Military Trail. People ask me all the time, of course, if I miss the county, and I say, well, no, I don't miss the county. I do miss the people, though, I will say that. And especially one person sitting over there, my former colleague, Commissioner Berger, miss her a lot. But, being executive director of the South Florida Regional Transportation Authority, which operates Tri-Rail, is just like being a county commissioner, except I have to be accountable. Last year we celebrated our 30th anniversary at Tri-Rail. This year, come around the fall, we should be welcoming our 100 millionth rider on the system. That's 100 million trips off of the roads during that time period. It's we take the equivalent of 1 lane of traffic off of I-95 each and every day. And we're very popular. Last year, we had the highest ridership ever in the history of Tri-Rail. Our on-time performance was improved, and that's even with gas prices being stable. In a lot of commuter transit systems, it's dependent on the price of gas. The higher the price of gas goes up, the more users of mass transit. But our ridership has been increasing even with gas prices stable. One of the reasons is that we are a service-based tourism economy. I know that Commissioner Berger and I spent a lot of time on the Board of County Commissioners trying to bring high-tech business, biotech business into our county, and we have had good success with that. But ultimately, South Florida is a service-based tourism economy, and
You can't run a hotel from your home. You can't work in a restaurant from your home. So a lot of other transits around the country have a lot more, their ridership is declining because they have a lot more telecommuters. Here, tourism is through the roof, and we, for example, connect to all 3 international airports, Palm Beach International, Fort Lauderdale, Miami, and actually I'd suggest that to all of you to take advantage of that connection to those airports. I mean, even Miami, which is, you know, obviously a longer distance from here to get down to Miami, but our train goes directly into Miami International Airport. So you have the choice of many more flights and cost savings by going to Miami Airport on Tri-Rail. You don't have to fight the traffic, you don't have to pay for parking, and we have found that it's just a very, very popular part of our business to serve airport riders. So, of course, all of that subject these days to coronavirus. We don't quite know how that will affect our ridership. We'll just have to wait to see. But even notwithstanding that, still we're finding that commuter rail, very popular, passenger rail, I'll talk about Brightline in a second, and we're looking to expand. We have plans to extend our existing service currently, and you know, just as a little background, but many of you are sure familiar, we have 2 parallel tracks in South Florida. The eastern tracks owned by Florida East Coast Railroad, which operates Brightline and FEC Freight, and then the track that we run on, the South Florida Rail Corridor, formerly the CSX tracks, where we operate Tri-Rail and CSX operates freight and Amtrak operates their passenger service. So we have plans to actually extend our service into downtown Miami. We'll still take you directly down our 72-mile corridor into Miami International Airport, but half the trains will also go on a connector onto that eastern FEC track down into Miami Central Station, downtown Miami, where Brightline is. Now, we're not to be confused, of course, with Brightline. If you're familiar with that, they are what we call in the business an inner-city passenger service. Limited stops, so we're familiar, Miami, Fort Lauderdale, West Palm, soon a Boca Raton station. Ultimately, the key to their success is to go to Orlando, whereas we are a true commuter railroad, taking people primarily to work and to school. We stop every 3 miles. We operate during rush hour at 20-minute intervals as opposed to 1-hour intervals on Brightline. And most importantly, we're far, far less expensive. So if you get on a train right now, I just checked, Brightline train from West Palm Beach to Miami, you will pay upwards of $28 plus $8 parking, whereas a Tri-Rail ride from West Palm Beach to Miami, most of our people take shorter distances, but if you take that distance, it will cost you $8.75, no parking, and of course we offer a senior discount of 50%, so just thought I'd throw that in as well. And so we cater to a far different clientele, or as I tell folks, we are not the train that has the champagne card coming up the aisle. So we have great plans to expand. What we don't have are a whole lot of revenues. Another thing that I miss not being on the Board of County Commissioners is that I miss having taxing authority. I miss having zoning authority. In fact, Tri-Rail is funded through appropriations from FDOT, the bulk of them, and then the 3 counties that we serve, and that funding formula has been locked in place in a state statute that was adopted in 2010. So, as you all can imagine, you can't really live on the same amount of money in 2020 as you did on 2010. So when I walked in the door as executive director a year ago, we're facing a $16 million deficit and going. And so we took some immediate measures to tighten our belts, reduce costs. We reduced our workforce. We reduced that deficit from the 16 to about $2.9 million, but we still have to increase our revenues by going back to FDOT, and I'm so glad Commissioner Berger's sticking around, to the 3 counties. And of course, I'm having those conversations, and they'll be hearing from me during this budget year. Because we are popular, people do want our service, but not only that, rail is the only mode that is a solution for workforce housing, because we all know the predicament that we're in with affordable housing in this county and the 2 counties to our south. But you can work in a neighborhood with affordable homes, or you can live in a neighborhood with affordable homes and work in downtown Fort Lauderdale or downtown West Palm Beach by having that access with commuter railroad. So it's good for workforce housing, it's good for jobs, it's even good for public safety, since trains, despite what you may read, are safer than cars. The National Council for Safety did a survey recently and found that you're more likely to die of radiation or die in a cataclysmic storm than you are riding on a passenger train. So we are safe. So that's the nutshell version. I do feel, even though with our funding difficulties, that I think we'll be able to overcome them and look for very positive things in the future. I'm always reminded of the story of the father and the son who were driving in Washington, D.C. down Independence Avenue, past the National Archives building. I'm sure many of you have been there, where they have the original Declaration of Independence and the original Constitution, and inscribed on the side of the building, it says, "The past is prologue." And the son asked his dad, "Dad, what does that mean, the past is prologue?" And the father thinks for a second. He says, "Son, what that means is you ain't seen nothing yet." Thank you all.
Very cool. Well, you can stay up there, and Nick will go up there too. And just a little commercial for the Alliance Mature Driver Course, Safe Driver Course. We give that. We got approval by the state of Florida Motor Vehicle to give the course. So we're trying to make the road safer, and we've been in Lexington Club, we've been in Lakes of Delray, we've had several classes here at the South County Civic Center. So we'll come into your community if you would like that. We have questions now. If anybody would like to line up here, delegates of the Alliance. Okay, now we're going to finish up here, because we have no more questions, with Nick Uren, who has something else to say, he says, about Sims Road.
Yeah, thanks, Lori. I just wanted to append what I said earlier. So the county road program is adopted every year, and it is updated every 6 months. So they do a mid-year update, they do an annual adding of the new 5th year. That 5-year road program does have right-of-way, design and right-of-way funding for the Sims Road extension included in it. It does not have construction funding included in it. So that means that they are moving forward with the design of Sims Road extension to Atlantic Avenue. They just haven't funded the construction of that project in the 5-year period of their program. We would expect that because the design and right-of-way is there, that the construction would be funded in the new 5th year in the next update to that program. So I just wanted to make sure that the group was aware that the county is moving forward with the Sims Road extension.
Thank you so much. Great. Oh, you know what? Somebody just said something about Flavor Picked. Is that another county road?
It is. So that, I assume you're referring to the extension of Flavor Picked over the turnpike? Or you're talking about the section from Lyons to State Road 7?
Across the turnpike.
Right. So that one is also included in our long-range plan, but that one, I'm looking at their road program as we're talking. They have identified design and study funds and right-of-way funds in the 5th year of their program. So they are working on, they've identified an intention to work on the construction of Flavor Picked over the turnpike, Lyons to Hagen Ranch, in the 5th year, which is fiscal year 24, late 23, all through 2024 timeframe. Again, no construction dollars for that project, but they have identified an intention to look at that one carefully.
Thank you.
Oh, there you go. Judy, right?
Yes.
Yeah.
My
Judy
question is, I live on Elfair Ranch, and the bridge has been removed, at Flavor Pick. How long will that project be?
The flavor
How long
pick
will the
bridge.
project take? There's no bridge.
Judy just had knee surgery, so we're giving her a break. You said, what was that?
I'm sorry, I live on
Yeah,
Elk
I
Ranch.
heard the question. The question is, the Elk Ranch Bridge has been removed and we're replacing it. That was an interesting project. It's a county, again, a county road, but the county submitted an application to the TPA and said, could you please fund the replacement of this bridge? It's an old bridge, and the DOT is building it with TPA funds on behalf of Palm Beach County. That being said, I have all that in my head. I don't have the exact project duration and schedule in my head. I hope it's not long. For your sake, I hope it's not long.
Thank you all for coming out.
Thank you, great. And next month, it's all going to be about green infrastructure, planning, zoning, and building will be here. It's going to be a great. And sign up for that event right over here if you would like to, that April event, and we'll give your names to the sheriff.